Is Dr. Buru James, Director Health and the Murang'a County. Together I am with the heads of departments and the hospital in the county Department of Health. Yesterday we were, like happened in the county, as a health department, we were called urgently to respond to an incident in Kangari Health Center where 15 casualties had been taken to. And we were able to very quickly mobilize 5 ambulances, fully manned by our emergency response staff. They arrived in Kangari and they found the team there had already stabilized the patients. There were 15 in total, 8 civilians and 5 police officers. We were able to coordinate their evacuation from that hospital. And 4 were brought to Murang'a Level 5 Hospital because they required a more specialized care. So by today morning, 2 have been taken to theatre, stabilized, and taken to ICU, but 1 had passed on arrival. The similar case happened also in one of our sister facilities in Kangema, where they were able to attend to 8 civilians and a number of police officers, and they were able to stabilize them, and also they also reported 2 deaths, but most of the other casualties were treated for minor injuries and discharged. So basically, as a response, as a public health response in an emergency situation, the response time was good. The county was fully prepared in terms of ambulances, health, emergency response health, and medical commodities. So all the necessary interventions were done in order to save their lives. So we are very grateful that the county preparedness was in top shape in the medical field, and that is why we were able to save a lot of lives. But we have a very rallying call, and that we are urging the public to very respectfully, give way to emergency response vehicles, both on the highways and as they come to the hospitals. And when the casualties are delivered to our emergency departments, we very honestly request the public to respect our emergency response health workers and our casualty department workers, so that we give them time to take care of the situations where they would wish to storm into the hospitals, they would wish to, see the injured. That, in a way, puts the health workers at risk and also delays the necessary intervention that is needed in such an emergency situation. We as a department, we'd always, if it's relatives or the public who may have their relatives in a casualty situation, we will always brief them when the patients have been stabilized. So if they are in need of information, we urge them to be patient, because we periodically give public information on status of clients, and therefore there is no need of storming emergency departments to get that kind of information by themselves. Thank you very much. Since the patients have been stabilized after theatre and in ICU, our doctors are monitoring the progress of these clients, and referral may be required probably for one of them who has a chest injury, and that the decision will be made by the attending doctors.
Roka hau. Kuro to kanyo ni oro e. Kama.